Inpher describes itself as being a cryptographic secret computing pioneer that enables advanced analytics and machine learning models while keeping data private, secure, and distributed. Please tell us more about what this could mean in healthcare. I have the pleasure to welcome Manuel Capel, Director of Business Development at Inpher. Manuel, the floor is yours.
Merci. Hello, everybody. My name is Manuel Capel. I work at Inpher. I wanted to thank Olivier and Christian for having us here tonight, and thank all of you for your presence. So yes, we are a secret computing company, and we will see what it means exactly. But just as a little introduction, we are based in Lausanne. We have offices in Lausanne and San Francisco, and we have been pioneering secret computing. And secret computing is this family of technologies you might have heard of: federated learning, homomorphic encryption, multi-party computation. And what this allows to do is allows to do federated learning, federated AI use cases. And what does it mean? It means that you can compute data, you can obtain results from cross-referencing data or aggregating data, but without ever exposing or even moving this data from one location to the other. So this is sometimes a bit magical. People can't believe or can't understand how can we even compute data without seeing it, right? So I'm going to walk you through a small example to see how it works. So imagine there are 3 people who would like to know their average salaries. But they don't want to tell each other their salary. So how can they calculate their average salary? So we have 3 players here, A, B, and C. The calculation of the salary will be the sum of the salaries divided by 3. So what multi-party computation would do in this case, we would ask each player to divide their salary into 3 random numbers. So the first one was 75. The red one was 75. This is divided in 47 plus 28 plus 0, right? So everybody can understand that. And you can see that the sum of these numbers is still the same, because even if you divide in so many random numbers, it doesn't matter. So the next step is that we ask the players to exchange one of their numbers with each of the other players. So the red one is going to give the 0 to the yellow one, for example, and the 28 to the blue one, and so on. So they have now exchanged the numbers, but the thing is that this is a random number. So if I receive the 0 from the red player, there is no way I can infer his salary. With 0, I cannot guess 75, right? But you notice that the sum is still the same. So the last step is that every player is going to add their new set of numbers, and they're going to get a new sum. They're going to share these numbers, and they're going to get a new sum. And this new sum is the same sum as before. We just changed the order of what is inside the sum, but the result is the same. So this is a very simple example. It's like the most basic type of computation that we can do. It's called secret sum and secret average. But what we can do with this goes way beyond, because it enables computing data from different sources. Like, for example, take the data from a hospital, from a pharma company, from a research lab, and by using this type of techniques, these privacy-enhancing technologies, why not the data from the wearables? We can now, these players can collaboratively compute models. They can compute predictions. So what if this patient, we can see the Garmin data about heart rate, but we also know that he has this and that condition, then we can have a model that is going to take that into account. But the beauty is that the patient data is not shared. The only thing that is shared is the result at the end. So the result can be a model, it can be a prediction, it can be a very simple calculation of statistics. So what is this used for? It's used in many areas, in finance, in marketing, for example, in capital markets. But in healthcare, it's very useful for clinical trials, for example. So with this technology, pharma companies, they can investigate or analyze data from the hospitals without seeing the patient data and identify if there is a cohort of patients there that would be useful for their clinical trials. In drug development, is also useful because then drug companies can use lab data, they can use patient data to create models to develop the drugs without seeing the patient data. In genomics, we also did some projects there to use machine learning to create a relationship between genotype and phenotype using machine learning, using secret genomic data from the patient that could not be shared, once again. Patient journey, so you have the data from the insurance company, from the hospital, from the lab, and you have this 360 view of the patient and what they are doing. And then again, disease prediction. You have data from the hospital, you have certain labs analysis, you have data from Garmin, you have data from research lab, etc. And then you can maybe create models to predict certain type of diseases. And I think here the real hurdle that we are trying to solve is that this data is normally cannot be shared, right? But with this technology, even though you cannot share it and the data stays in the location, you can still compute these models, and you can compute better models. So one example of what we have done, I think there is a slide missing. So I wanted to talk about one project that we did with the CHUV, Lausanne University Hospital. We were sharing, we created a model to share neuroimaging data and some clinical data. So neuroimaging data from a radiology lab, so this is image data. And we share it with some clinical data from the hospital. And we created models to, based on these data inputs, to predict early prediction of Alzheimer's disease. So it would be great to have this and to also include data from Garmin. Once again, that would be a great thing. So this is almost the end of my presentation. This product is available. You can actually test it. We have many use cases where you can actually play with the product and try to understand what it does. You can have the data there. You can run some predictions. You can run some models. It's on inpher.io/trial. So I invite you to join there, subscribe, and play with our tool. With that, time's up. Thank you very much, and I hope to answer your questions later at the cocktail. Thank you.
Perfect on time. Thank you very much, Manuel. It's interesting.